of the Community Relation Committee of the Board of Directors of the NYC Health and Hospital for Tuesday, I can't believe it's May 7th, May 7th, 2024. I now call a motion to adopt the minutes of the March 5th, 2024 meeting. Our chair, Jose Padan,
Yes.
Dr. Katz,
Yes.
Dr. Mathon. Yes. All in favor?
Yes.
The minutes are adopted. So I just want to remind you to mark your calendars and reminding the Board of Directors annual public meeting for the fiscal year 2024. I encourage our CAB members to attend and provide testimony. These meetings will begin at 6 p.m. sharp on the following dates and location. For Brooklyn, Tuesday, May 14th, 2024 at Kings County Hospital. For the Bronx, Tuesday, June 4th, 2024 at Lincoln Hospital. For Staten Island, Tuesday, June 18th at Seaview Hospital. Speakers are asked to register in advance by writing or calling Mrs. Calethea Hercules, our Calethea Hercules, Secretary to the Corporation, at 212-788-3360. Again, for everyone, 212-788-3360. Schedulers to present annual verbal report this evening are the following. But before I go there, who remembers how many minutes we have to speak? Everybody's quiet, so they don't remember, Dr. Katz.
5.
We only have how many minutes?
5.
I can't hear you.
5.
5 minutes. So that's what we're doing. But again, let me welcome all of you. It's so good to see you on a nice day. Finally, another nice day. So thank you. So right now, I would like to call Gotham Kemlin.
Dr. Katz report.
Oh, now how I always try to forget the main thing, doctor report. Oh, my goodness.
Thank you,
Dr.
Madam
Katz,
Chair.
please.
I'm happy to see all of you and for all of us to be together. When I came to Health and Hospital 6.5 years ago, one of the biggest surprises was we have this huge art collection, except most of it was in storerooms, so nobody could actually see it. Through the Bloomberg Connects apps, now 850 of the pieces of art can be viewed by anyone. And you can also go to Gouv, which has amazing art from the WPA area, as well as many of our other hospitals and clinics. Michelle Lewis was recognized as a Power Woman of Manhattan for 2024. We're proud of her. Several staff members were honored by Schneps Media for Healthcare Heroes recognition list, and we are proud of them. We have now served 14,000 people through our telehealth behavioral health services. New York City Health and Hospital South Brooklyn had a year without any urinary tract infections that we were very proud of. Elmhurst celebrated Earth Month with a series of green events. One of the things that I'm most proud of Health and Hospital is every single one of our hospital has lawyers to help our patients deal with issues of eviction, of issues with getting benefits that they're entitled to. No other set of hospitals provides that for their patients. Local author Carmen Noboa Espinal had an event at Queens inspiring children and families. East New York has a new 3D mammogram machine, which is both more effective and much more comfortable for patients, which we think is great. Correctional Health Service unveiled a new mural at the Reentry Center at Rikers by artist McKinnon. We are opening 16 mental health clinics in public schools, and Bellevue is now able to do a very technical micrographic surgery for the treatment of skin cancer. So lots of great things, Madam Chair, going on at our hospitals and clinics.
Wonderful. Thank you, and that's so important to know. Thank you so much. We will now hear from the four facilities presenting their verbal annual report. Each presenter is allotted 5 minutes, and we are grateful for the work that went into preparing this. It is a lot of work. Thank you in advance to all our speakers for their time and commitment to the system. Mr. Chair, Dr. Katz, Dr. Marthon, do you have any questions or comments? Hearing none, we will now call Mr. Corey Evans, the CAB chair from Cumberland. Is he
Good
here?
evening. How are you? How are you, man?
I'm good. I almost thought you wasn't here.
I'm here.
Okay. But I'm so glad to see you.
Yes. Okay. So let's begin. I would like to begin. The accomplishments and recognitions of Cumberland. We had an AHA and an AMA Gold Award for BP Control September 2023, pardon me. A standardized vendor / supply management, which resulted into 0 losses. Health First top performer for Medicare overall quality ratings, OQR. Health First Quality Incentive Program achieved an overall rating of 3.54, with over 182,000 in incentive earnings / Medicare. Over 13 successful employees engagement events. Prescriptions filled with insured patients visit volume. Health Equality Index. Patient-centered medical home reaccreditation. OSHA SUD program 2-year recertification. A VFC audit 100%. A New York State planned amendment, SPA 230039 award Cumberland, approximately 225,000. Replacement of cooling equipment and infrastructure projects that was replaced. Replacement of cooling towers, the parking lot LED lights, upgrades to improvement lighting for patient safety during evening hours visits. The Wellness Center project. The project supports the development of psychological, safe, and wellness-centric spaces for all New York City health and hospital employees. The radiology department replaced outdated imaging equipment to improve health screening, care delivery, and optimize patients' outcoming. Updated equipment received ultrasound mammogram machine. Frequent complaints by patients and residents. Communication / updates on waiting time. Response training provided to all staff members and clinicians. Communication framework created by the Stutter Group for use of healthcare-based staff communication and with patients, and each other decrease patient anxiety, increase patient compliance, improve clinical outcomes, access improvement, response overbooking strategy, standardized templates to ensure clinical teams have the availability to overbook same-day and urgent visits. Recruitment improvements, women health, increase our availability through hiring an additional clinician to support the needs of the clinic. This has resulted into improvement with work queues and wait list management. Issues impact the community served by the facility. Challenges in the mental health service due to shortages of providers. Unaffordable housing market, distribution of low-income lottery apartments. Access to healthier food options. Safety and satisfaction. Updated wayfinding and directories throughout Cumberland. Updated radiology equipment for ultrasound mammogram machine. Adept training for all employees to ensure patient satisfaction. Quarterly reduction for all nursing in phlebotomy, chronic disease management, and preparation for testing. The accomplishments and highlights. Brooklyn Borough President Antonio Reynoso, President, donated $1.1 million to Gotham Health Brooklyn Region 1 and 2. Years of service. Rosa Pena, 30 years of service. We like to acknowledge her. Well, she was acknowledged, I should say. The acknowledgement. We would like to extend our gratitude to Cumberland clinical and operational leadership for their tireless commitment and serving the healthcare needs of our neighborhood in Brooklyn, as well as our strategic partners who help amplify and impact our work. Just to name a few: Brooklyn Borough President Antonio Reynoso, the New York State Senate, Jabari Brisport, New York State Assembly, Farrah Sofont Forrest, New York City Council, Crystal Hudson, and U.S. Congress, Nydia Velasquez. This concludes my report.
Thank you so very much.
Thank you.
Mr. Chair,
No questions. Thank you for the report.
Dr. Katz,
Report.
Dr. Marthon,
Thank you.
thank you.
Thank you.
So our next presenter is from Elmhurst, Mr. Tomlin. Did I say that right?
Right.
Okay.
Good evening. I have a Shamayapsia report. We had a very busy 2023. Last year, we had close to 700,000 ambulatory care visits and over 130,000 emergency room visits. We are a major economic engine in our community. According to Healthcare Association of New York State, Elmhurst Hospital currently generates 6,000 jobs, $210 million in tax dollars, and an overall economic impact of over $1.5 billion. Our patients and the languages they speak are incredibly diverse. In the fiscal year 2024, we had one of the largest uses of translation services in health and hospitals. The hospital has received recognition from US News and World Report as a best regional hospital and as high-performing hospital in 9 categories. Elmhurst continues to be a leader in chronic disease prevention and has been recognized for several years in a row by the American Heart Association for providing life-saving care for stroke, diabetes, and heart attack patients. Phil Jackson, one of our employees, was recognized as Employee of the Year for Health and Hospital. Elmhurst Hospital also recently announced a partnership with ESL Hospitality Business School. Elmhurst is the first American hospital to join the ESL Alliance. This collaboration represents a significant milestone in the intersection of hospitality and healthcare. Elmhurst Patient and Guest Services team opened the Guest Services Center. Located in the hospital's main lobby, it offers a fully renovated, calming, and private environment where patients can get assistance. We recently completed several projects to improve our facility and enhance the care we provide, including new operation rooms, several projects in radiology, mental health area improvements, new roofs, and a solar panel installation. Plans for the future include a new labor and delivery wing, a new endoscopic chute, the relocation and renovation of our neonatal intensive care unit, a major renovation of our front entrances and lobbies, creating much needed clinical space by moving non-clinical staff to satellite offices. Community issues. Elmus Hospital is, excuse me, Elmus Hospital is in an underserved community. Community members are concerned about the rising cost of housing and food. Expanded access to resources such as youth centers and services for seniors are needed. Because of many stress factors, adults, children, and young adults in the community suffer from anxiety. Many need expanded access to mental health care and resources. Hospital improvements. The hospital is continuously striving to reduce wait times for services and make services easier to access for our patients through several ongoing initiatives. And this concludes my report. Thank you.
And thank you. Mr. Chair,
No questions, thank you.
Dr. Katz,
No questions, thank
Dr.
you.
Mawthorn,
Great report, thank you.
thank you again. So next we have sitting in and will be speaking for, I don't want to say the name wrong now. Ms. Slainberg, for the CAB chair. On behalf of the CAB chair, Dr. Morris will be speaking on behalf of the CAB chair of Gouverneur.
Thank you. It's my honor to be here. I'm here actually with Susan Sales, who is the CEO of the Skilled Nursing Facility.
Oh,
I
okay.
am here to represent the Gotham side of the building, but we'll speak for both of us.
Yeah.
The next slide, please. So in terms of infrastructure and equipment, at the main campus on the ambulatory care side, we are pleased to say that we have no significant infrastructure needs, having undergone a recent major renovation. But at Judson, one of our satellite sites, we do have upstairs space that could be renovated for usable space. That actually did begin, I'm happy to say. We also could use a new CAT scan if you know anybody with $10 million to spare. At the skilled nursing facility level, the outdoor garden is finished. There is some money that was awarded for some gym equipment, and some refurbishment of the dining area is underway. Next slide, please. In terms of safety and satisfaction, we actually enjoy very strong patient satisfaction scores at Gouverneur. I have February data there. The March data was even better. Our March data actually surpassed national and state 50th percentile significantly. So we really have a great staff that is responsible for that great satisfaction. In the photo there, the top photo, that's Jasmine Pasquale, who is one of our pediatric nurses and won our DSU award, a fantastic nurse, and is really, a great example of such a team that really delivers. On the skilled nursing facility side, there are some strong satisfaction ratings as well, 81%, with respect to security. And did you want to add anything to that?
That was with regards to safety and
Safety.
security at 81%, and our last survey, overall satisfaction was 76%.
86%. The next slide, please. We do have some complaints on a per thousand basis, 0.3 per thousand, so about one complaint for every 1,000 visits that we have. They're largely about communication and access. We constantly are reinforcing eye care values with our staff and hope to improve that. We will actually be undergoing a template optimization to open more access at our site to address some of these concerns. So hold on to your seat, Dr. Katz, keep getting more appointment slots.
I look forward to that.
The skilled nursing facility sees only 3 to 4 complaints per quarter, about 1 a month. The comments on the press gaining tends to be positive for both sides. On the skilled nursing facility side, when it comes to complaints, it's about the promptness of response in food, although the food is very tasty. The next slide, please.
Susan, are you doing the same Plant Forward Foods as the hospital, or is it a different provider?
For the most part, it's the plant forward food, and then we also have a Chinese menu or
Excellent.
Asian menu.
Excellent.
Oh, yeah, that's good.
There's a lot of text here. This is a community, the Lower East Side, a historic community, an immigrant community, a community that is a high poverty neighborhood, which of course limits healthy options and makes it difficult to access health care. We have 22% of our residents living in poverty compared to 18% of the city overall, so a little bit higher. That said, the life expectancy is higher on the Lower East Side. The obesity rate is lower than New York City overall. Chronic disease outcomes are better overall. The next slide, please. This is a graph that just is meant to demonstrate where some of our successes and challenges are on the Lower East Side. In the middle, that lower bar, the darker bar that's longer than the light blue bar, is an indicator that diabetes is more prevalent in our community than it is in Manhattan, which is the bar above that, and in the city, which is that horizontal line. So that is something that we are very focused on and have actually at Gouverneur some very strong outcomes with respect to. The next slide, please. This is where we thank Dr. Katz, who is not just the president and CEO, but a provider at Gouverneur, our CAB executive leadership, the auxiliary, and Susan and I for each other for a great partnership.
This was the quickest. Wow, I love it. Mr. Chair,
No, great work.
Dr. Katz.
Morris, what is our long-term plan with the street level space that we used for immunizations that we're not currently using? It was, I think originally it was like a patient lounge. Now it's kind of vacant.
So that it's funny that you should bring that up because there is a plan potentially to expand our dental services and add cosmetic dentistry to our list of services, and that space was eyed as a potential space for that, although I don't think it'll work. If it doesn't work there, we are actually thinking about perhaps enhancing the space again and making it a community art center to highlight some of the art pieces that you mentioned. Gouverneur has such a rich history, and we were actually, as we were walking over, talking about how wonderful it would be to have some of our historic photos displayed. And there's actually a trophy case to highlight some of the great awards that we have received.
I think that would be good.
Any ideas?
Well, I mean, it's not a huge space, right? So it can't, right? But what I don't like it vacant because it's street level and it just sort of looks a little deserted.
Yeah.
Do you know when you walk by and it just like something left and nothing, right, and nothing returned. So I feel, and it's so visible because everyone who goes in that entrance has to pass it. And so, if we don't have a clinical use for it because it's not big enough, then I think we need to return it to something that looks more like a patient, staff, community lounge, so that it looks like the space is usable, right? And the nice thing is you could do that and you could still someday turn it into something else, right? Because that's just a question of furniture but I think we should try to do that soon. I'm happy that it does not appear that we're going to have any more immediate needs for vaccination, of a mass nature, and it certainly did well, and it was a great space with a separate door, and I mean, it was phenomenal that we had it, and maybe that's even an argument for why you shouldn't turn it into a dental space. But I think we should do something for it.
Dr. Martha?
I want to thank you for sharing your Daisy Award. I think it's so important that we do recognize even those that are recognized. And for nurses that go above and beyond, as is the job is tough enough. But when they are extraordinary nurses, we should all recognize that. So thank you for sharing that information.
So my question is, how was the patients, was they receptive to the plant-based food, the different foods?
So we find that for the diet, that some people enjoy it very much and others seem to look for foods they're more familiar with. So I'd say it's on some of the menu items, they really enjoy it, and other ones they're not embracing as much. And they continue to offer tastings and seeing how they can change up the menu with regards to that.
So is it working?
I'd say it's working.
Yeah, well, it'll work after a while when they want to really, if they get hungry. And that's what happened to me, and I got a day that I eat like that, so I got used to it. But again, thank you so very much. Good report. Okay, so moving right along, we're gonna go to Lincoln.
Hi,
In the
how are you?
house,
Lincoln
okay.
Montalvo, Cab Liaison and Intergovernmental Relations.
Okay, so
One
let
of
me
the-
introduce you, because I'm gonna practice trying to say your name right.
Okay.
Okay, so from Lincoln, representing the chair cab today is Antonio
Montalvo.
Manzaro.
Montalvo.
Okay, I'll get this. I'm close, right? Okay. So, so I present to you, Antonio.
The chair was on his way. I think he's coming up with the elevator, but let's give him a chance. Infrastructure and equipment. Okay. We received several allocations from different elected officials. Salamanca, the borough president, and Congressman Richie Torres with Schumer for beds, for operating room equipment. And we have a very good rapport, actually, with our elected officials. Oh, there we go. I hand it over to the chair.
So our chair, Mr. Richard.
Yes.
Okay.
Good evening.
Good evening. So you have 5 minutes, right?
Yes, I'm going to get those very quickly.
Okay.
Good evening, CRC Chair, Mrs. Rowe Adams, and CRC members, Mrs. Hernandez Pinheiro, and Dr. Marthone. I'm joined this evening by Cheryl Simmons Oliver, our ED of Community Relations. Dr. Roca could not be here with us this evening. I'm Richard Izquierdo Arroyo. I'm the chair of the Lincoln Cab, and it's really a privilege to present to you our community relations report. Can we go to the next slide? All right. Lincoln Hospital has been fortunate to benefit from a great deal of support from our elected officials with a significant capital investment this last year. We received $3.2 million from Councilman Rafael Salamanca to upgrade our ultrasound and neonatal equipment in the OR. Borough President Vanessa Gibson provided $1 million to support our Guns Down Life Up program. Lincoln now has, I think it's 3 Da Vinci robots, is it? 3 or 2? But we want 3. We have to perform minimally invasive surgeries. This is something we are very excited about. Go to the next slide. Guest relations patient representatives have facilitated improved communication between unit leaders, providers, patients, and visitors in support of a person-centered care culture. Guest relations have extended their services to 9 p.m. between the hours of 5 p.m. and 9 p.m. Evening rounds are conducted in the inpatient units to assist staff in addressing patient and visitor inquiries and concerns to improve the care experience. Go to the next slide. At Lincoln, we have CAB members that serve on the PFAC and PCC who liaise on our behalf. This ensures that the CAB remains informed on the developments of the partnership between patients, patient families, and key staff in the decision-making process from bedside to the board side. The voices of our patients, families, and community are key to ensuring that we achieve the best possible quality of care delivery. In 2023, there were 98 good catches reported, compared to 68 in 22. These good catches are critical to strengthening Lincoln's culture of safety. This enables timely investigations and timely follow-up so that events can be prevented from happening rather than simply reacting to mistakes that have already occurred. Frequent complaints fall within two major categories, so we kind of lump them into these two bullets here. One is communication, attitude, and behavior of staff, coordination of care, and the waiting time. The other is the poorly handling of patient property, documenting the property and placing it in the stretcher upon transfer to the emergency department. What is being done to address these complaints? The emergency department patient relations and patient experience have implemented the following. Frequent rounds are conducted in the ED to proactively identify and resolve issues prior to escalation of grievances and asking patients about their property upon admission to ensure it is properly booked. The ED revised the property booking process and established a storage room within the ED for patients' belongings and a program for radiology ED safety box to secure valuables during imaging exams. Some noteworthy announcements. Lincoln's ICU was recognized by the American Association of Critical Care Nurses, receiving the Silver Level Beacon Award for Excellence. This is significant because it validates the hard work of our nurses in particular, our policies, procedures, and level of engagement amongst the staff, patients, and stakeholders. Lincoln also received the Bronze Certification for Excellence from Plaintree. Some initiatives that have been implemented to address frequent complaints by staff are a wellness program for staff, a facility-wide strategic plan for the Care Experience Executive Steering Committee that requires every department to have an active care experience initiative for which they are held accountable, that includes specific goals for the questions on the staff survey. The creation of a complaint and grievance subcommittee that meets weekly to take a hard look into the grievances and responses to identify trends that can be addressed in a timely fashion. Issues impacting the community. Gun violence in the South Bronx is at an all-time high, as well as throughout New York City. It's prevalent in our schools, in the subways, and of course on the streets and the neighborhoods surrounding Lincoln Hospital. Lincoln, being a level 1 trauma center, is greatly affected by the consequences of such gun violence. This out-of-control gun violence situation, Lincoln is a first responder to. I would say 90 times out of 100 that occur within the 4 community service areas, community board areas, districts in the South Bronx. So what are we doing about it? Lincoln has the Guns Down, Life Up program, which is phenomenal. Not only is the team boots on the ground after incidents occur, they have implemented initiatives at the grassroots level to take proactive measures to give the community alternatives to gun violence. Such initiatives include connecting young adults to OSHA training and job placement, To date, over 200 individuals have completed training. They provide services in New York City schools, expanded their community outreach services, and have grown their youth development services to include anti-gun violence employment program with 140 youth enrolled, 130 high-risk youth enrolled in its after-school program with 190 on the waiting list. As of 2023, Guns Down Life Up is known as the first and only hospital-based crisis management community program on site and is a model for expansion for our system-wide efforts in partnership with the New York City Department of Youth and Community Development for prevention, intervention, and community mobilization. As we all know, the Bronx is 62 of 62 counties and health disparities. We all heard of all those statistics. High rates of diabetes, hypertension in particular, right? So what are we doing? What are we doing about that? So the lifestyle medicine program, which Mayor Adams launched, when was it, last month, 2 months ago? Supports patients in making evidence-based lifestyle changes, including a healthful plant-based diet, increased physical activity, improves sleep habits, stress reduction, avoidance of substance use, and stronger social connections. Adults living with pre-diabetes, type 2 diabetes, high blood pressure, heart disease, or health conditions related to excess weight are eligible to enroll. At the ribbon cutting ceremony, we heard testimonials from patients that are no longer hypertensive, diabetic, and have no need for medication as a result of sticking to the lifestyle medicine plan and a plant-based diet. I have to have my pork chops, so I don't know about the plant-based stuff, but it's proven to work.
Yes.
That concludes my presentation. This is some photos of our CAB in action, members of the Legislative Affairs Committee in action there. I do want to take a moment to acknowledge and express gratitude to our mayor, who I love, and I will be working to make sure he gets reelected. Say it openly.
Yeah.
Dr. Katz, who has really touched my heart in ways that he's not even aware of. And his administration with Deb Brown and others, Kemphy, who take care of us. It's an amazing team of serious professionals, and we are privileged to have you working with us. And I also like to acknowledge Karen Dixon, who has set a high standard for cabs throughout New York City. I have benefited from your experience, your expertise. I regret not being able to work with you for a much longer period of time, but a lot of your best practices I'm pushing to implement at Lincoln. Some get quite resistance, because change is not easy for everybody, but I plan to stay the course.
That's great.
Thank you.
Very good.
Wonderful.
Very good. Acknowledgement of Karen Dixon. Thank you so much, Mr. Chair,
No questions. Thanks for the report.
Dr. Katz.
Nothing except to say Lincoln Hospital is a challenging place to work because of the health disparities that you mentioned. And there are a lot of heroes and sheroes who come to work every day at Lincoln Hospital and do an amazing job.
Dr. Marthon.
Just want to say congratulations on the weekend. And the Guns Down program seems to be amazing and wonderful that you're strategizing to help reduce the amount of patients that are coming in because of this. It's just a wonderful job. Thank you.
Thank you. So let me just add to that. First of all, I remember when Guns Down Life Up started. We all started at Harlem Hospital together, little small group of us. I am very, very proud of Guns Down Life Up in Lincoln. I was in a meeting and I just heard that Guns Down Life Up has expanded.
Yeah.
And trust me, I'm all around the city with, of course, the gun violence and when all the programs started. But I have to say, and I'll say this in public, the other organizations, you got to get there. Guns Down Life Up is one of the best ceasefire programs in the city. So when you talk to, what's my friend name ahead of it?
James,
When you talk to him, you say, Jackie Rose said, And he's gonna start screaming. I want you to know I have every shirt and new jacket that every time they get a new jacket or shirt, they make sure they call me and give me one.
Where's my jacket?
So I, yes,
we'll get
so
there.
I do. So I don't know about your jacket, but I'll wear my jacket and think about you. But I just want to commend you, and I want to commend Lincoln for the work they're doing with the gun violence, because you get an awful lot of patients, because it's an awful lot of shootings. So you keep up the good work, and thank you. I want to thank all the cabs that presented tonight, because it let us know that our work is not in vain, and that we're working hard out there in the communities, in the city, in these hospitals for our patients. So thank you so very much, all of you. So before I close, thank you. So before I close, I just want to remind everyone, get the word out. We have a public, some of our meetings. I just want to remind you that Brooklyn is May 14th, Kings County. The Bronx, Tuesday, June 4th, Lincoln Hospital. Staten Island, oh, good old Staten Island, June 18th, 2024, at Seaview Hospital. It's very important that our community know, so they could know what's going on. The CAB members to attend and provide testimony. These meetings will begin at 6 o'clock sharp at these following locations. Speakers are asked to register in advance by writing or calling Ms. Calethea Hercules, Secretary to the corporation, at 212-788-3360. So please, make sure you get the message out, because this is important when we see our public come. And on that note, Mr.
Any-
Chair,
Any,
Dr. Katz.
All good.
Dr. Mathon. Any old business? Any new business? Hearing none, I now call a motion to adjourn this wonderful meeting. Thank you all.